All right. So, like I said, on the first leg of the program, we are going to be touching on health. And it's something that happens all the while. We're looking at hemorrhoids as a hidden struggle. Why are we doing that? Like I said, something that affects lots of people. And I was asking my colleagues this morning, who is much more affected within the gender? Is it the male or the female? Anyway, so many people experience discomfort when sitting or using the toilet. But how often do we talk about it openly? I know we don't. A lot of times we prefer to hide it away. So could it be hemorrhoids? That's a very, very big question. Well, hemorrhoids, also known as piles, are a very, very common condition, yet many people suffer in silence due to embarrassments. While they are not usually life-threatening, they can cause significant discomfort and affect daily life if not properly managed. Anyway, I do not know much about this. I'm just a novice in this area. So joining me to shed light on this subject matter is Dr. Ashimiyu Shitu, who is Consultant General Surgeon with our Jolad Hospitals. Dr. Shitu, thanks for joining us on the program. Good morning.
Good morning. Thank you for having me.
All right. It's your first time on the program, right?
Yeah, that's correct.
How was your journey here this morning?
It was smooth.
It was smooth?
Yes.
All right. So let's start by doing what we usually call concept clarification. Dr. Ashimiyu, what are hemorrhoids? Talk to me.
Okay, so hemorrhoids, or what some other people call pile, are actually swellings in the distal part of the rectum and anal canal. Okay, so when this thing swells up, sometimes they can show outside the anus, around the anus. That's external type, or sometimes they might be inside the rectum and not apparent outside. But both of these can cause symptoms.
Right.
So they can cause symptoms.
Is there a native name for it in Yoruba, for instance?
Yes. Yeah, I'm a Yoruba person.
So what do you call it?
So we Yoruba people call it jadi jadi.
Okay.
Yes.
That's what they call jadi jadi.
Yes, that's what they call jadi jadi.
Okay.
Yes.
So how common are hemorrhoids in Nigerian societies?
Hemorrhoid is quite common in Nigeria now that we are adopting Western lifestyle in terms of our diet and our way of life. The normal African diet is rich in high fiber, so for those that takes that, they tend to have less of hemorrhoid. But these days, as the world advances, we are now taking more of a European diets that are low in fiber. So that's one reason why it is becoming common. Very common. In terms of male and female, you made mention of that during the beginning of the program. Yes, is equally seen in both sexes.
In both sexes.
Yes, just that the time that it peaks in both sexes is slightly different. Yes, sir.
Because I was thinking it's going to affect more men than women.
Well, so people even think it will affect more women than men because, women, they carry pregnancy, and pregnancy is a risk factor for hemorrhoid. Okay,
so that's eye-revealing this morning. So what are common causes for hemorrhoids?
Yes, like I mentioned, the first thing to talk about is the diet. All those diets that will lead to having constipation. So chronic constipation is a common cause of hemorrhoids. Diets that are low in fiber. Example of diet that are high in fiber is whole grains and tubers, which is the common things that we take in our environment. Yam, yes, amala, eba, maize.
So all those ones are very rich in high fiber.
They are rich in high fiber. But
these are foods that are telling us it will cause you too much sugar in the body, diabetes and the like. So how do we balance this?
So food has to be in the right quality and quantity, and that is how you prevent diabetes, at the same time prevent yourself from having hemorrhoids.
Right. Okay, so is hemorrhoids, or jadi jadi as the case may be, is it age discriminatory? Is it age biased?
Well, it is commoner among the working age group, and that alludes to the fact that the risk factor is also common in this age group. Part of that risk factor is when you sit for long hours. Right. When you consider people living in
so Lagos, when you say age group now, I need to put a number.
Okay.
So between what age?
So I'm talking about between the age of 18 years to 60 years. It's less common in children. What we see in children is what we call rectal prolapse. That is commoner in children. But hemorrhoid is the one that is commoner in adults age group.
Wow.
Yes, sir.
Okay. And for anyone that is coming down with hemorrhoids, what are the signs? What are the symptoms that one will begin to notice?
Yes, these signs can range from subtle signs and symptoms to those that are really alarming. The subtle ones that people may feel is protrusion around their anus. So after using the toilet, then you notice there's a fleshy protrusion around the inner region while trying to clean up. Well, some people also have itching. They complain of itching. You sit down, then you start having itching in that area, you know. The other thing that really alarming is the occurrence of blood, because as the symptoms progress, both the internal one and the external, as I described earlier, can actually bleed. Wow. And this bleeding can be from something little as what you see on your tissue paper when you clean up, to something really alarming that the person can actually pass out in the toilet.
Wow. So it could come like in that form?
Yes, it can come in that form. And sometimes it can become thrombose. That is when there is clot formation in that protruded part, and then patients start experiencing serious pain that will require urgent hospital presentation and attention.
Wow. So is jadi-jadi, is it life-threatening?
Well, it's really not life-threatening. It's just that it impairs the quality of life. Imagine if you're at work, you can't sit properly because of pain, or you're having itching, or you just go to use toilet and you see blood. Of course you'll be scared. And then people don't like talking about it because of where this thing occurs. Is around the anus. People don't like talking about,
because it's difficult for you to show that to your doctor. Or
yes, sometimes they are not comfortable to even tell their friend and share their problems. So
right.
They just suffer in silence.
Yeah, that's very, very true, because it's not something you can be discussing. So how can one handle it? How can one manage that? I mean, if you see someone who is coming down with these kind of signs that you've mentioned,
yes,
what are the best ways to handle it?
So my advice would be that although some people try home remedies and try to use ointment and do sit bath and all, but the most important thing is first to have a proper diagnosis. As long as you are not doctor, even if you are a doctor, you are not supposed to be treating yourself. So I would suggest such people should seek expert care.
All right.
Come to the hospital, get examined, because it might be something else. It might not be.
Which is very, very true. So yeah. I just want to ask that question too. That what's the difference? I mean, how will you know if this is not a cancerous protrusion that is coming out within that particular? Is there any way you can distinguish between maybe anal cancer or hemorrhoids? Is there any way one can determine that?
Yes, for the expert, there are things that we look at, from the symptoms that the patient will complain with. You understand? So, and also when you examine the patient, there are differences. Cancer is usually hard. If it is anal cancer, it's usually hard. You have a stenosis in which stool will not pass out easily. But hemorrhoids, they are just enlarged veins. Okay, even though they are swelling, but they are not hard.
Can it burst?
Yes, it can burst, and that's why it causes bleeding.
Wow. You
understand? So another thing to know is that sometimes hemorrhoid might be a pointer to a more sinister problem in the rectum, and that is why such people that have it should come to the hospital, so that as part of examination, the doctor, it
can be revealed.
Yes, the doctor will.
So when you say a more sinister problem, what are we looking at here?
We are looking at things like rectal tumor, for instance, rectal cancer.
Ooh, yes, so it could be.
Yeah.
All right, then Lagos Traffic Radio 96.1 FM, the first segment of the program, we are talking health, but something very, very not talked about, but it is common, I understand. And so it is something that requires lots of attention. Dr. Shitu, yes. If 10 people walked into this room, how many of them would likely have a pile?
Yes, because this is Lagos, and in our clinic, for instance, if you have like 10 people coming to the clinic to visit you, at least 2 to 3 of them will be having complaints.
Wow.
around the it is that common.
Wow.
Yes, sir.
And that spans across both male and female, right?
Yes, that's correct.
Okay, then. So we're still looking at the traffic situation, even as we're talking health. And we did tell you about the breakdown of a 40-foot container laden truck with rear and stud problem on Oba Akran Way. This is by Wema Bank in Watts Agege's control room. What's the latest with that one? I'd love to have an update as it relates to that. Those of you coming in from the Lagos Ibadan Expressway, heading towards 7 Up, linking up with Alakpare down to Gudu, and connecting the Third Milan Bridge. It's still looking good. Ikorodu Road as well, faring pretty well at this time. If you're coming in from 12, connecting K2, heading towards Ojota, and of course that entire stretch leading to Maryland, Obanikuru, Fadi, still looking pretty good as well. Funshaw Williams, not bad at all. Things begin to slow down a bit by the time you approach a bridge. All right, then, if you have any questions for the doctor, I have very, very limited time on the program this morning. You can feel free to connect with us, and that's on 08099 120777. Okay, 08099120777. Dr. Shitu, let's talk about the remedy that Al Jalad Hospital is bringing to the table. What do you guys offer? Okay,
so the treatment for hemorrhoids start from lifestyle modification. So, of course, we start by counseling such patients on what type of food to eat. They should eat food that are rich in fiber. They should drink plenty of water. Also, the other thing to consider is the bowel habit.
Okay, just a second. Let me see if we can take this call that's coming in. Lagos Traffic Radio. Hello there.
Hello, sir.
Yeah.
Good morning, sir.
Yeah, good morning. What's your name?
Yeah, this is Agbola from
Agbola.
Yeah.
Okay, go ahead.
I just had your report now.
Okay.
Okay. So, we have been on issues in around the Olu. Coming out to myself, we don't know what to do. Doing the fake pitch.
Okay, Itawolo in what mile 12? Okay, all right, let's find out for you. Agbola, thank you so much. Those of you that are there, traffic managers, he says Itawolo in what mile 12 is pretty slow, and they're wondering what's going on. I would love to have that feed as well. A message here says, good morning, sir. Is it true that eating too much rice can cause pile? Jide is sending that one. And Jide, thank you so much. Doctor, is that true?
Rice is an example of whole grain, but like it's generally known, too much of everything is actually not good for you. So our advice is you vary your diet, and when you are eating rice, you should add vegetables to it.
Okay, so that will help to balance it out.
Yes, so that the stool will form bulk, and then you won't have problem evacuating your body.
All right, so if you have driven through mile 12, coming in from Ikorodu this morning, you can also share your experience with us. Let's help Agbola and others. He says from Itawolu and connecting mile 12 is a slow one too. Another one here says, good morning, doctor. Please, sometimes my stool feels like pepper is inside my body when I pass it out. Is that pile? You didn't put your name, but thank you so much. So, can that be pile?
It's unlikely to be pile. There are other things that can cause pain in the anus while passing stool.
He says it's peppery.
Yeah, peppery, okay. So, sometimes when you eat spicy food, it can give you that sensation.
When you're stooling?
Yes, when you're stooling, it can give you that sensation.
So it reflects too?
Yeah.
Okay, all right. Then this one says, please, sir. He said, please, sir, I have pile, but I don't take soda or alcohol. I'm confused. What is causing it? Chiri from Ikotun. Is there any connection between soda?
Yes, because we talk about diet as one of the risk factors that can give people pile. Okay, so direct as a direct cause, no, but as a indirect cause, yes,
it can happen.
Yes, it can happen.
All right. So when we come to Al Jalad Hospital, what section treats pile that we can come to?
Yes, so the general surgeon takes care of pile at Al Jalad Hospital. As I was saying about the treatment, we talk about the lifestyle modification. Part of it is also not to be postponing going to toilet, because that will give you to over time.
Oh, so anytime you are pressed, you feel like stealing.
Yes, just go and evacuate.
Just go ahead.
Yes.
Okay. Yes. This one says, good morning, Traffic Radio family. Say, please, can walking too much or standing for long hours make hemorrhoid worse? Because my happens to worsen when I either walk too much or stand too long? Sheun Ibrahim. Oh, Sheun Ibrahim, thanks so much. That means you have pile too. All right, so doctor.
Yes. I agree. Standing for long hours can actually make hemorrhoid.
It could aggravate it.
Yes, and it's actually a risk factor, and that is why even surgeons they are prone to having hemorrhoids.
Surgeons too.
Yes, if you stand for long hours,
this is serious. All right, doctor, please. Is it true that sitting on toilets for long, scrolling through phones can cause pile? Steve is sending this one in. Steve, thank you.
Yeah, that's gritty as charged. Nowadays people go to toilet with their phone and they sit. Same thing, before now, people used to go to toilet with newspaper. Be reading newspaper in the toilet.
Right.
Those are high risk for having pile because you keep straining.
Hey, but what's the connection for me? I'm just sitting on the toilet. I might just be relaxing now. So what's the connection between that and pile?
No, you have gone to toilet to evacuate your bowel.
Yes.
So as you are seated on the toilet seat, you will be straining intermittently. As you are straining, you are pushing out the pile.
Okay.
Yeah.
Okay. Now I'm seeing the connection.
Yeah.
Let's begin to wrap this up. So, in your hospitals, you have specialists that can attend to people that come down with hemorrhoids?
Yes. So, we have both comfortable and private settings where all your complaints will be dealt with.
Okay.
So we attend to hemorrhoids.
Where are your hospitals located?
We are located at number 12 Safaratu Street, Gwagada, Ajolad. We also have an outlet at Isolo and another one at Salem House in Agege.
All right.
Yeah.
Any of these centers?
Yes, you can present in any of these hospitals. You will see us there.
Okay, then. So that's the way it is. So anybody that is coming down with hemorrhoids or perhaps jadi as the case may be, what's your advice to that person as we round off the program?
All right. So my advice is that such person should not ignore the symptoms. Because for one, you can't just diagnose yourself. You need someone to diagnose you. What if it's actually not pile or jadi? That's number one. Number two, for proper treatment, the one that will avoid complications that can follow the treatment is better to see experts who are going to evaluate and diagnose you and then offer you treatment that best suits your own situation.
And quickly, this last one, don't just sneak it in from the men. They're asking, will pile affect performance in the other room?
No.
It won't.
There are no connections.
All right. Doctor, it's nice having you in the building. Thank you so much for being here.
Thank you for having me.
Okay, so we've been reflecting on hemorrhoids as a hidden struggle for most people in Nigeria. And Dr. Shitu Ashimiyu, who is Consultant General Surgeon with Arjulad Hospitals, has taken us on this excursion. A brief break. When we return, we'll do our birthdays before we switch gears to Insurance Digest.